Welcome back to the Progressive Rehab and Strength podcast. I'm your host, Dr. Alyssa Havison, and I'm here with my co-host, Dr. Rori Alter. And today we are going to be talking about Rori's history with her hip injuries, hip symptoms, how she's managed to navigate them while continuing to train and compete at a very high level over many years, and the history of when they began before she even started barbell training. So, Rory, why don't we start with you telling us about why are we talking about your hips?
Well, we're talking about my hips because it is hip month here at Progressive Rehab and Strength. But yeah, I mean, I think that the most important thing that I want to get across one of the most important things that I want to get across with this episode is that it happens to everyone. And just because we know what we're doing about injury prevention, injury risk reduction, and we are the people who help people who are injured rehabilitate and write their programs so that they stay safe, stay healthy, and can continue to train, our bodies are we're all human. We're not robots, you know? So even the best of the best, not that I'm saying I'm the best of the best, but the people who are supposed to be the people who help us not get hurt or recover from injury get hurt themselves. Because injury, it's not injury prevention, it's injury risk reduction. You know, like I always say that we can look both ways before we cross the street. We can, make sure that no one's coming. We can be at the crosswalk. We can wait for the walk sign, but we still never know what's coming around the corner, you know? And so I wanted to kind of share my story because I think it's important for people to recognize that it really does happen to everyone. And it's usually the people who have had long journeys and stories related to what they do that helps them relate to their clients and get them, like, we really understand. Like, even Alyssa, you've had numerous injuries. Actually, before we turned on this podcast, you had a training blooper. If you're watching on YouTube and you see Alyssa moving around a lot, it's, she tweaked her back. So we're all human, we're not robots, and life happens. And our bodies, we talk a lot about what we see on imaging and how those things exist, not from the training itself, but those things exist in our body. And there's things that we do or don't do in training that can cause our things that are lying dormant and asymptomatic to start to present themselves. So I just wanted to share this because I've never stopped training. I've had, maybe a week here or there that I have to not train. And more so, I've stopped training, not ever stopped training, but I've had more interruption to training from having a kid than from any injury. And, we can talk about what training looks like through injury and all that kind of stuff, but trying to always look at the bright side, always continue to train no matter what. So I guess, where did it start? My symptoms in my hip. So the official diagnosis upon imaging, and this isn't even a diagnosis because it's just what I have in my hips, which is called FAI, why can't I even say it today? Femoroacetabular impingement. So I have bony over, and I have the pincer type. So I have bony overgrowth on the acetabulum in both my hips. My acetabulum are considered retroverted, so there's nothing, it's not abnormal, it's just my normal. I have retroverted hips, but I do have this bony overgrowth that I wasn't born with. It developed as I got older. And then as a result of the numerous incidences that I've had in my hips, I ended up with an MRI, and we found that I also have a labrum tear in the hip that they MRI'd. Now, I have symptoms periodically in my other hip that could indicate that there's probably a labrum tear in that hip as well. But we don't need to know if I have it because I'm not having surgery on it. So, but both my hips have been x-rayed. They've diagnosed or identified that I have FAI and I have a labrum tear in my left hip. So those are just,
When did
yeah.
you have, so I'm just wondering, in your within your journey from PT
Mm-hmm.
school and barbell
Mm-hmm.
training,
Mm-hmm.
when did you have imaging or first have imaging and find this out? And like, what was your reaction to it when
Yeah.
you found that out?
So, well, my first symptoms that something was like weird in my hips was actually before I even started barbell training. Um, and I only share this not so anyone can make inferences or I think anything of my life, but my first symptom in my hip was present when I was in the bedroom, and I was having difficulty with traditional positions with my hips, and it would cause me pain. My hips would lock, they would catch, and I was like, what the heck is going on? But I didn't have any other symptoms, so you kind of work around that.
It's something
And
that not a lot of people talk
it's
about, but it's a
yeah,
real thing.
this is something, yeah, I mean, when we talk, and this kind of is why I want to share it, just to like let you guys know as clinicians, when we are working with you, like we've been through it, and like our clients will not tell us anything about the bedroom and their symptoms, or the bathroom or showering. And we have to ask these questions because we know that injuries don't just affect you when you're walking or when you're in the gym or when you're sitting at your desk. They affect every aspect of your life. And, a lot of people with back pain don't talk about like, well, I can't be intimate with my husband or my wife because of my back, but like that's one of their biggest concerns, but they'll never share it. So I'm sharing that being intimate was like the first sign that I had something wrong with my hips, because like we know that that happens, and you should share that kind of information with your clinician. So that was the first sign. I was probably like 21 or 22, and I'll be 36 in May. So this has been ongoing since I was pretty young and for a long time. So that was the first sign. I didn't really do anything about it. I wasn't barbell training at the time. My symptoms started to get worse though in PT school when we were sitting a lot. And I could never sit still because my hips were just always aching and irritated, and I was always changing position or like lying on my belly, and my back would start to hurt. So that, but of course I never did anything. I was like, oh, I'm just like, in PT school and sitting a lot, my hips hurt because I'm sitting all the time. And there's not really much, like, I don't have a sit stand desk in PT school. So anyway, then when I graduated PT school and started doing a novice linear progression with barbell training more seriously, I think I had probably gone through my first competition. Honestly, the timeline is like blurred at this point because I'm getting old. But I was doing a novice linear progression, but I was also teaching. I was doing a lot of HIIT training, kind of like Metcon classes, a lot of jumping, burpees, mountain climbers, plyometrics, like all that kind of stuff. And I was teaching group fitness HIIT training like 3 or 4 times per week. And, I'm like the gung-ho kind of person. I'd like do the classes. I don't like, there's no days off for Rori at that point anyway, which was part of the issue. Like I was doing this novice linear progression. I had no idea what rating of perceived exertion was. I was squatting, benching, deadlifting, and overhead pressing, squatting every session. And they were hard squat sets, really hard. I was probably resting like 5 to 7 minutes between sets. And I hadn't not finished my linear progression at that point. So I was on like 5 sets of 3 for squats. And I'd have to look through my videos, but I've seen videos because I remember what outfit I was wearing. I remember like what shoes, I remember, everything about it. I could probably find that video. But I just couldn't walk. Like I could not stand up. I couldn't like take a full step. So and it was bilateral. I really had severe hip flexor inflammation, and it was so bad that John, who was my boyfriend at the time, was like, you got to go to the doctor. And so I went to this hip specialist that we sent a lot of people to. I still see him for my hip injuries. Like, I would recommend him to anyone. And he, did the kind of general orthopedic screening tests on the table. And he said it seemed like I had really bad hip flexor inflammation. So it wasn't like, he took the x-ray because that's what they do. He said, you've got, retroverted acetabulum, you've got FAI. We see it pincer on the x-rays, but you have like severe tendonitis in your hip flexors. Like, that's what's causing you pain right now. And, one could say that it's because I've got FAI that my hip flexors were more susceptible to irritation. But when we look at the videos and we look at what I was doing in my training at that time, my technique was awful. I had, I was doing low bar. I had the bar like halfway down my back. It wasn't standing up straight all the way. I had terrible knee slide. And I was overtraining in the sense that my sets were so hard and my technique was suboptimal. And outside of training, I was doing 4 HIIT classes a week and probably doing cardio on my own outside of that as well, And so we can see that it's kind of like a straw that broke the camel's back. Like, just the weakest link in my body was just like, no, thank you anymore. So
I think some people can get away with that for a certain amount of time. You may have not gotten away with it as long as somebody else may have because of what was already going on with your hips.
Yeah.
But, usually when we see that and when people are doing that, oftentimes they're fine for a while.
Right.
Yeah. And so when people say, oh, well, I used to be able to do all of this, it's not because there's something wrong with you now. It's just because, it was too much. And eventually you hit a wall in some way.
Yeah. I just overtrained, and literally, like, the path of least resistance for the overtraining in my body was my hips, and that's pretty much how it's been forever since then, like, it's not my shoulders, it's not my feet, it's not my knees, it's not my upper back or neck, it's my hips that are like, you are doing too much, or like, now you've got to pull back a little bit. So I did get and I don't even want to say diagnosis about my hip, about FAI, because it's not a diagnosis. So that's the thing I think that's really important, is that FAI isn't a diagnosis. It's a thing you've got, and the diagnosis is going to, maybe I'm like wording this wrong, but it's more about like, what are your symptoms, and are they actually related to the FAI, or is something else the cause of the symptoms flaring up, So it wasn't that my FAI was flared up. It's that I had hip flexor inflammation because of everything else, probably in combination with having this type of hip structure, right? So, and at that point, I didn't have any symptoms of a labrum tear, so there was no point in going for an MRI. And so what he recommended was I think he gave me a prescription for Celebrex, which is, or maybe Mobic. I can't remember. But one of the, a very strong non-steroidal anti-inflammatory. And, I took it, but it caused really bad GI symptoms. So I stopped taking it. And what I did was, at work, between patients, I would lie on my stomach on ice. And ice, because I was in an acute flare up, it wasn't like months later and I'm like, oh, my hips hurt. It was like, I couldn't take a full step. That's how bad my hips were hurting. And it was like all the time. So I would lie on ice. John would stretch me very gently when he was free and I was free, when we were both at work at the same time. And because we worked together at that PT clinic. And then I cannot remember at that time if I took like totally off barbell training for a period of time. but it wasn't like an extended period of no upper body training. But John did suggest at the time that instead of, he and I doing my novice linear progression, that I actually work with a coach who could do some intermediate programming for me. And so I started working with a coach who had a type of medical background. So it was someone who like understood injuries, understood the type of training that we were doing with barbell training, and introduced the pause squat to me, which was a really, really helpful movement. And at the time, we thought that the pause squat was helping me because it like takes away the ballistic motion or the stretch reflex, and improves your control. And that was kind of like what was hurting my hips. But it actually allowed, and now we know, and the way that we use the pause squat in rehabilitation is that it really improves your control and your positioning at the bottom of the lift. So it wasn't the ballistic motion that was causing me the problem. It was the positioning and my technique under load that was causing the problem. So introduced the pause squat, decreased my frequency of squatting. So I was squatting, I would say like 1.5 times per week. And I say half because one was like my heavy squat, and then I had a light recovery squat. So I was on a 4-day upper lower split, which was really helpful. So decreasing the frequency at that point. And I think that this is like a really crucial thing to understand. And this is what happens with a lot of people who are running the traditional starting strength novice linear progression, is they run it way too far and they do not switch to an intermediate program at the right time. And I ran the novice linear progression just way too far. And my technique fell apart. My recovery was awful. And I could not handle squatting 3 days per week anymore. And I really have never been able to handle more than 2 times per week since then. I did have a coach in the future from then, in the past from now, who had me squatting 4 days per week. Actually, it was the same coach. I had 2 coaches have me squat 4 days per week after that. And I was trashed. I couldn't sleep. My hips hurt all the time. I couldn't handle it. So 2 days per week is like really my limit with squatting. And it's been that way since.
I think that's like an important thing to point out, because a lot of people, especially if they do start with squatting 3 days a week and we find out that maybe that's not optimal for them, and we make a program change for whatever reason, there's almost this feeling
They get upset.
Of they're not doing what they should be doing, like, or 3 is the standard and that's what they have to do, whereas that's not for everybody. I can't squat 3 days a week. I can't deadlift 3 days a week. I don't do my heavy deadlift same day as my heavy squat. Like making these types of changes for a program to figure out what works best for you to allow you to continue to train, rather than like having you continue to squat 3 or 4 days a week and ultimately stopping training eventually, because that's not something that you can maintain long term. Making modifications to that layout of a program and continuing to train is better.
Yeah. And I think that's like, it's so important to, and this is why it's hard to just, follow a template or say like, I'm going to do Texas method now because I'm not going to do a beginner program. I'm going to do Texas method or HLM or whatever. And they have squats 3 days per week. Like, even if you can still do Texas method without doing the light day squat, you can still do HLM or VLI, which is our version of an intermediate program. And we have 4 different layouts for VLI, and we have 4 different layouts for it because there's so much variability in what people can handle. So like the traditional HLM or VLI or Texas method has a light squat day on day 2. You don't have to do that light squat day if that's too much squatting for you, so do take it out. And you don't have to fill it in with anything, like I don't fill it in with anything for myself. So that was kind of like the beginning of the journey for the hips for me. I think you had asked like, when did I like
yeah, I think that my original question was Well, so you told us when that was when you first had your imaging.
Mm-hmm.
I wanted to get an idea of how you responded to that, like how that felt to you, because I think that having an image and then having somebody say you have X, uh, uh, people respond to it differently. To some people, that could sound devastating and terrifying, and to others, it's like, oh, okay,
Yeah,
they
no,
know and
I had a
understand.
really good support system. So, and I think at the time I was trying to get my starting strength. Oh yeah, actually, I was trying to get my starting strength certification, and I had failed it the first time, and I think I've talked about that before, not on the podcast, but when I'm like actually in our courses, I talk about how like I failed a lot of things the first time, and like, so just keep trying, right?
Yeah.
Um, so, um, I was this was actually like just before I was going to the starting strength seminar again. And I was like, Jesus, my hips are like so inflamed and I have to perform all these lifts the way that they want me to perform it. Like this is your stance, this is your toe out, this is how you do it. Like this is where the bar goes. Here's how you do power cleans. This is how your deadlift stance should be, blah, 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 right? But it was painful for me and it was very uncomfortable. And so it was I was not because I knew it was like kind of like an acute inflammation and it was really the first kind of injury that I had to my hips. I knew that I was going to get better because I was like confident because I'm a physical therapist. My husband's a physical therapist. I'm working with a coach who has a medical background. And I just was like very confident that I would get through it. And but we talk about. I think we have in our hip functional anatomy. In our hip functional anatomy podcast that we had come out at the beginning of the month, we talked about table assessments to like have an official like diagnosis or like classification for a person's hips to figure out their stance. So it wasn't that I needed that, but I have a very kind of like frog like stance as a result of my hip flexor irritation and my FAI, like the impingement, like the pinching feeling that I get in my hips when I squat. I have a very narrow stance with my toes pointed out like more than 45 degrees, probably like 60-degree toe out. And in the starting strength model, my stance doesn't fit the starting strength model. So I actually felt confident going into the seminar to be like, excuse me, I have to stand like this. I can't fit your model because I have this in my hip, so it actually gave me a little bit more confidence going into that to justify my stance and why it's a little bit different. So that, but I didn't need imaging to figure that out. And, we've talked about that. I didn't need imaging to figure out that my stance is more comfortable for my hips like this, but for the naysayers to any like change in stance, I was like, well, excuse me, actually, I have to.
Yeah, and sometimes it's just trial and error. And it's interesting because a lot of people that I've worked with, and including myself, I mean, I do have a history of anterior hip issues.
Mm-hmm.
Usually that narrower stance, more toe out. Because I sort of squat like that too.
Mm-hmm.
And
Mm-hmm.
most people that I work with who have
Hip
a
issues.
history of anterior hip issues,
Yep.
I don't, and I don't always need to get them there. They kind of figure it out that
Yeah,
that's
exactly.
where they
Yeah,
feel better. But yeah, it's okay to not look like the person next to you because you're not them.
exactly. Yeah. And so I just knew that that was how I had to stand to squat. So I said that and Rip actually said to John, he was like, "Don't procreate with her." Like because yeah. But anyway, we
Because of
have
your hips.
yeah, because I don't have good hips, and it's worse for the gene pool, to have hips like mine,
Survival
I
of the
guess.
fittest, Rory.
I know, right? Well, we have a really cute 2.5-year-old now, and he's extremely athletic, and he already is squatting in the gym with us. So, whatever. So anyway, uh, no, it just gave me confidence. It backed up my feeling as to why I needed to kind of change my stance. So it was nice to have that backup, but I don't think just over my years as being a clinician and the same with you and the same with John, like I don't know, maybe it came from my experience. John and I are not like pushing a certain, we start with the traditional, like, here's where you start and then kind of figure it out, but you don't need a table test or an x-ray. Like, it wasn't because my x-ray said I have retroverted hips that I said, okay, well, because I have retroverted hips and FAI with pincer type impingement that I need to stand like this. It was that I stand like this because this is what's comfortable for my hip. And oh, if you're questioning me, well, actually, I don't have the typical hip. I have the less typical, like, and it's normal to have FAI at this point, like, so, and the more and more research that comes out, the more and more the better that imaging gets and the better our diagnostic tools get, the more we see FAI, So it's kind of like a normal thing in the hip at this point. And cam versus pincer versus retroverted versus anteverted, like, these are all just versions of a hip that you might have, So it's not a diagnosis. It's just what you've got in your hip, and then your symptoms, you have to put them together and say, okay, your FAI isn't hurting you. This is what's happening with your hip, So I'm trying to think where we're at with this story. When did I get the labrum tear, I guess, is the next question, or diagnosis of that. But what were you going to say?
Yeah. So, at some point you did have an MRI.
Yeah.
And I don't want to jump ahead asking questions and cause this story to be out of order. So I think
No,
that
it's
sounds
not.
like that's what's next.
That is what's next, because and this is, we talk about this. This episode is coming out before our episode with Eric Helms. But we talked about insurance with him. And for him, it was more of the insurance related to having surgery. But for me, I actually wasn't in any acute flare up of my hips. I kind of just have, so kind of between when I had the hip flexor irritation at the end of the NLP, when I started working with a coach, to when I had the MRI of my hip, really what happened was I started to develop these symptoms in my left hip of just like deep achiness. And I kind of felt, those like suction stickies that you, like, if you put like a sign on a window, it like sticks on
suction cups.
Suction cup, I guess that's what they're called. It kind of felt like I had this like suction cup thing going on in my hip that really just needed to be like pulled and popped. But it was like so deep in my hip. And we talk about, if you go back to the hip lecture, the functional anatomy lecture, the labrum like causes this like congruency situation. So this like, it like keeps everything, good and well and tight and moving well in the joint, absorbs shock and all this stuff. And just like something did not feel right in my hip. I was constantly aware of my left hip, totally unaware of my right hip. And it wasn't this like incident that happened after the hip flexor thing. It was just like this weird achiness. And I would just like put my hand around my hip. It's called the C sign. And I didn't know it at the time. Like, this is not something that I was aware of even as a physical therapist. Cause like when like FAI and labrum tears were not like this whole, like, there were not like, maybe we got like one hip surgery like that in our clinic a year. It was not super common back then. And I just would always like put my hand on my hip, like right from like the groin around to the greater trochanter. And I would just be like, it's just like really like deep in there. Like, I can't explain it, but it's there. And I guess it was my like clinical instructor. I don't know. Maybe my timeline is bad, but I learned about the C sign from my clinical instructor, who I then ended up working at in in 2014. But I was just always like trying to massage my hip, but it was so deep that I couldn't get it figured out. Like, it was just like I couldn't undo what the thing that I was feeling in my hip. And then I was deciding to leave my job to start PRS. And I was like, I know that I have FAI. I know that I have pincer impingement. I've got this achiness in my hip that just like doesn't go away. It wasn't like 10 out of 10. It was like a 2 to 4 at most. And it was just like annoying. And I was like, I'm leaving my job. I'm going to lose my insurance. Like it's now or never, because like my husband was taking his sweet time to propose to me. So I wasn't going to have insurance through his job. So I was about to have like probably not good insurance. And I was like, I just got to get this looked at. Not that we need an MRI to know what's going on in our hips, but for the sake of my peace of mind and the fact that I was losing my insurance and knowing my clinical history, I was like, I just want to know so that I have this piece of information to make decisions going forward.
Yeah, and if you're potentially going to be considering having surgery, then we do want an image, but
yeah. And I I had contemplated surgery many times, and at the time, because it was really so annoying. Like I had difficulty sleeping at night, but not like it's weird because it wasn't interfering with my training. It was more interfering with like intimacy and sitting and like I didn't even talk about all those symptoms. It was more interfering with, like I said, intimacy, sitting, long driving, sleeping, more that stuff than training. Training was okay. Like I could manage the symptoms with training. But those symptoms outside of training were not related to training. Does that make sense? Like it didn't matter if I trained or didn't train, my hip would still hurt outside of training. So I had contemplated surgery many times, but at the time, the surgical outcomes in the literature were not as good as conservative management. And it's different now. But now you have to say like, well, when you look at someone's candidacy for surgery, it's like, how long have they had their symptoms? How old are they? And like, because I've had my symptoms for so long, I probably am not a good candidate for surgery at this point in time. But anyway, I wasn't going to have surgery, but I just wanted to know. And so, and at the time they did, especially because I was losing my insurance. And at the time they did MRIs with contrast. So, man, that was a trip and a half, that MRI. I have really bad anxiety. I am currently on anxiety medication. But at the and this is only postpartum did I start taking anxiety medication because it's just too much to handle. But, I had like an anxiety attack when they were going to inject my hip. Because I was like, thinking back, how Alyssa, you asked me if like having the information about my hips, like, did that change my perspective or something? The imaging, like the x-rays, no. But like, I think I was so scared to know if I had a labrum tear because I would have to make a decision. Do I want to have surgery or do I not want to have surgery? And I was like really having an anxiety attack on the table. Like my body was like physically shaking. And the radiologist was like, I need you to relax because I have to inject your hip. Like you are shaking too much for me to inject your hip. Finally, like, and I really think it was because I was terrified of actually knowing what was going on in my hip, like facing the fact that like, oh, you actually do have a labrum tear. And like, do you want to know that and go around without having surgery, or like, what are you going to do about it? So anyway, I ended up getting the MRI. And it wasn't that day, but I think the next day, I was training. Maybe I trained too soon after having my hip injected with dye. I don't know. But at the time I was doing sumo deadlift because as this is another piece of information that we didn't talk about related to my hips and the FAI and whatever. So I really was uncomfortable doing conventional deadlifts. I know now that it was probably more related to stance. Again, trying to fit this model or this mold of, you know, heels under your hip bones and toes pointed out about 20 degrees, whatever. I can't squat like that because my hips are retroverted. And I've got FAI. And I was trying to do that when really I need to have my toes pointed, my heels pretty wide and my toes pointed straight forward, really, or maybe it's just like 5 degrees turned out to do a conventional deadlift without having back or hip pain. I didn't know that at the time. So I switched to sumo deadlift because I was hurting my back and we thought it was because of my hips. So I just basically switched to sumo deadlift as my main deadlift of choice. And anyway, so like 1 or 2 days after I had my hip injected, I was training with my girlfriend and my hips felt like tight. And I thought, this is so weird because I thought it was my leggings because they weren't like the super stretchy legging material. They were like the stiffer legging material. You know, if you're a girl, you know what I'm talking about. There's like some materials that are like super stretchy and there are some that are like stiff but stretchy, if that makes sense.
Yeah.
And so I thought it was my leggings and I kept like pulling them up higher to like give me more give in the hip area. And it wasn't happening. But I still went on with my workout. I was like, I don't know, I'm just going to keep training. And there was nothing wrong with my technique. My girlfriend was also a starting strength coach, and she was like, what the fuck just happened? I was like, I don't know. Like, I couldn't put my shoes on. I couldn't, like, she put my shoes on. She cleaned up my bag. She walked me to my car. She got me in my car. And I just tweaked my back because my hip was so tight that from the injection or from having the anxiety attack that my hip was just like gripping like a crazy beast, like whatever. I don't know. And I just like, that was the worst back injury I've ever had in my entire life. And well, that's when I became a bench specialist. So anyway, I got the results of the MRI. I have a pretty significant full thickness labrum tear in my left hip. But what am I going to do about it? At that time, nothing. Just wanted to know. We've documented, like, it's documented what my hip looked at that time at that point in time. So if we ever do like an MRI now, we've got x-rays and MRIs to compare it to in the past. So anyway, really messed up my back as a result of the MRI, I think. And, but never stopped training. I think I took 1 week off from training altogether, from the shock of the back injury. Then went in and started with sumo and high bar again. High bar just because that's like what I could do on my back. And I wore my belt, worked my way back up. But in the meantime, my coach programmed a really heavy bench cycle. My bench exploded because I was not, my upper body recovery was not competing with my lower body recovery. And that's like one of the cool things, that from like my own experience being injured is that we can really focus our energy on another area of our training when there's not as much competition for resources, for energy resources. So, and this is why it's, we always talk about like, you shouldn't stop training. You should train what you can. Other areas of your body are able to like train at max capacity if max capacity, like for training, not maxing out all the time. I got to be careful with what I say because I'm not telling anyone to max out all the time. I'm just saying like how much your maximum capacity is in terms of training load. Um, so that was kind of where my bench took off. Now I definitely, the hip injury, like the back injury was between my first nationals and my second nationals, I think. And so at that point, after the first hip flexor injury, that was before I went to my first nationals. So like my squat was able to progress. I remember I was at 5 sets of 3 with 212 and a half pounds for my squat. And when I went to my first nationals, I think I squatted like 303 or something like that. And my best squat ever before my psyche took over, because I have some issues with my squat related to, and we'll talk about that. That's in kind of related to the hip fracture that I experienced. I was able to take my squat from the 212 for 5 sets of 3 all the way up to 369 pounds over the next couple of years, despite having what people look at as a like career-ending diagnosis. Like you've got a labrum tear and FAI in both your hips, and like you get pain with squatting 3 days a week. So I'm sorry, like your squat's never going to go anywhere. Like stop squatting because you can't do it, kind of thing. So honestly, I squatted with no issues. The only issue I ever had with my hips after that, because even after that back injury, I was able to come back and squat. The only issue I ever had with my hips related to squatting was if I squatted more than 2 times per week. So,
I mean, that's fair because that doesn't work for you.
right. So, yeah.
And I think, and I really, again, I really don't think that that's that uncommon. I think that a lot of people do have a hard time with a higher frequency when it comes to squat and deadlift. And again, trying to meet this criteria that they think is ideal or optimal might not be getting them ahead. But you were flexible with your training throughout all of this, and there were probably days where you went in and just listened to your body rather than forcing yourself through a workout that ultimately would lead to other or bigger issues, which is something that I say a lot. It's like, well, listen to your body. It's one thing to have some discomfort, but pushing through a workout that's going to have you crawling out of the gym is not going to get you further just because you hit those numbers. So I'm assuming that you probably had days where you were just flexible.
Well, yeah. So not where I was like, well, I'm not going to do this today. So actually, and we have another episode coming out on RPE. This was when my hip injury was when I was introduced to RPE. No, my hip flexor injury. So that initial hip flexor injury that brought me to the doctor the first time when I finished my LP, that was when I was introduced to RPE after that from my coach. And he gave me like some percentage based training. So I had like assigned loads for my main lifts. But he started introducing me to RPE on my supplemental lifts. And then I think probably after the first couple of blocks with prescribed loads, he switched to like all RPE based training. And for me, I think at the time it was really good because, like you said, Alyssa, it allowed me to listen to my body, especially for my squats. And it controlled the level, the amount of the intensity level that I was working up to. And I think that what we see for a lot of people when they're injured, and we talk about this a lot, and especially if you go back and listen to like our sustainable training, like our sustainable training podcast episode, in our injury episodes, it's when people are training at too high of an intensity for too long of a period, that's when injuries start to creep in. And I was, like I said, I was at the end of my LP. Things were hard all the time. My rest periods were so hard and are so long. And I had all this extra fatigue coming in from my extra outside of training activities. So these fitness classes that I was teaching, and RPE based training really accounts for fatigue. And, so you want me to work up to an RP 8 on my squats today, right? But maybe I was in the city over the weekend and I walked 4 miles, so I'm going to just naturally feel a little bit more fatigued coming into my training session today. So that RP 8 that I hit today, the absolute load might be lower than what I hit last week because I'm more tired than I was last week because of the fatigue from all of the other things that I did over the weekend, And when we're looking at injury risk reduction, that's key. And these are things that, like our training method doesn't come out of nowhere, it comes from our experiences, looking at the research and putting that all together. And so I wasn't exposed to RPE until I was injured, and even when I first started using it with my clients, I didn't use it in the way that we use it now. The way that we use it now in our training method has evolved over time based on our own experiences with injuries, our mistakes, or our experiences with clients, I don't know where I was going with that. Where did that come from? Listening to my body.
I was talking about you sort of being flexible and listening to your body and making modifications if you needed to on a given day, rather than forcing yourself through something that might not be the right thing to do.
Yeah, and RP definitely helps with that. So I'm glad you brought that up because I forgot this whole missing piece to this puzzle here that we do is RPE, and that's kind of where it came from. Like I saw it work with me, and I really recognized where my injuries came from, not just technique, not just the morphology in my hip, but from a combination of everything, and so I really was able to train my squat. We did pause squats for a really long time and tempo squats for a really long time, and that really helped me decrease the symptoms in my hip, but continue to train. Anyway, I was able to work up to, I went to how many nationals? 2014, 15, 16, 17, and I think 18 was my last one before I decided to go into baby making mode. And then I did the Arnold in 2015, 17, 18, and 19. I missed registration for 16 because I had a migraine and slept through it.
So I'm going to interrupt you because there is another piece of your hip journey that you haven't mentioned yet.
The fracture.
Speaking of the Arnold. Yeah.
Yeah. Well, so like I said, I got my squat up to 369 and then I went into baby making mode. But my goal before having a child was I had 2 goals. 1, I wanted to go to the world championships. And 2, I wanted to squat 405. I have yet to squat 405, but I did go to the world championships for my bench press because obviously that is something that was that was a huge positive that came out of the original half of my hip journey. Was that my bench really exploded, and it's always responded really well to training. So I was able to go to 2 bench press world championships, which was awesome. Now and I also competed at the Arnold, what did I say? 2015, 17, 18, and 19. And in 29, and at the last 3 of them, I not only did the pro American, but I also did the pro bench. So I did 2 competitions in one day. I was not overtraining. We trained just as we normally would for the competitions. And going into 2019, I had some symptoms in my right hip. which was really never the hip that I had issues in previously. I only had issues in my left hip. The only time I ever experienced symptoms in my right hip was like the same original symptoms in my other hip was with intimacy. And other than that, my hip was fine. It was my good hip. But I started to, just feel this like pinchiness when I was squatting. Not like, it was not anything crazy. It really wasn't high alert for me. Like, I had so many other hip issues in the past that seemed so much worse that this just was like not high alert. It just seemed like a little tendonitis, but nothing like anything. It was not, I don't even know how to explain it. It just wasn't high alert for me.
And it also probably wasn't the hip that would quickly put you on high alert either.
Right. It was just like a weird, like little ache. I was like, oh, I'm peaking for competition, like whatever. I don't know. Like it's I only say it like, I only recognized it in retrospect. That's how not bad it was, like it wasn't enough to stop me. It wasn't enough. It was like, as I warmed up, I felt okay. It was just like, if I was a little off on my technique, it would bother me in the squat. I can't remember if it bothered me anywhere else. But the way that I'm speaking about it now is retrospective. Like, I didn't recognize it as a problem before the competition. So, which is so weird because it was like a very like it was a very traumatic injury, but it was accumulated traumatic, like it was ready to happen.
Mm-hmm.
So, which is usually what we see when we see these like weird sports injuries, like when we see like someone's like shin just snap in half on the basketball court. Like, that didn't just happen there. That was building, that stress fracture was building and waiting for like the right step to just snap, So anyway, the two judges, so in the bench press, I did the pro-am in the morning and the pro bench in the afternoon. And that's how it kind of like always was at the Arnold. So I weighed in, did the squat, can't remember if I maybe PR'd by like 2.5 kilos. Maybe not. Can't remember. But that squat drama, which we can talk about quickly after. Which I actually do. We should talk about the squat drama because it kind of, the bench injury led to more squat drama after that. So anyway, finished the squats, went into bench, and on my second bench press, and it was confusing because, and I think my coach would have told me to rack. I don't know, like I should have re-racked the bench, but I was like, I'm doing nothing wrong, so I should be getting the start command. My head was down, my ass was down, my feet were flat, my elbow, like everything was right. And so I just didn't know why it didn't even register that I could like rack it because nothing seemed wrong to me.
Well, I think that we've talked about this because you did eventually just get the start command, right?
I did eventually get the start command.
So at the Arnold, it's very bright.
Yeah.
And the chief referee is waiting for at least one side referee and them to think that you're ready. So the side referees put their arms down. So it's possible that the chief referee didn't see at least one arm go down, or that the side refs were having trouble seeing something. At a certain point, they should tell you to replace the bar depending on how long you've been holding it. But to me, it sounds kind of like there was just
confusion.
Like maybe it wasn't, especially if you didn't change your position to try to get a start command.
I didn't do anything. I was just like, what the heck? So anyway, I performed the lift, but we watched the video after, and I literally was holding the bar for 10 seconds before I got the start command. So obviously that pre-fatigued my lift, and it was so much harder than it should have been. So I pressed it up. I made the lift, but it was slow. And then, did I make I can't remember. Yeah, I made it because we did go up by 2.5 kilos, but I was like, I don't remember, but we went up by 2.5 kilos, and I strained my hip. I strained my hip flexor on that second attempt because of how much leg drive I was using to like get that lift up, right? Because it was so hard. And then on the third attempt, my leg drive, it was the straw that broke the camel's back in my hip. I heard a pop, 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 and I lost the bench. It like came down on me. Thank God for the spotters. Thank you, spotters. Always thank your spotters. They did a very good job. I didn't die. But it came down on me because my hip fractured. So I didn't find out. I just knew something was very wrong. My coach at the time, Chris Aiden, and my husband were like, freaking out behind me, but like keeping me very calm. I was like, when you have an injury and you just like break out into a sweat, and like it was so bad, and I really did actually want to pull out of a competition, but John was just like, lie down on the floor. I couldn't even straighten my leg out because so after I ended up going to my favorite hip doctor, Dr. Brian Neary, shout out.
Before you get to this part,
Yeah.
you finished the meet.
I did finish the meet, yeah. But I just want to talk about the diagnosis. So the diagnosis ended up being I avulsed the rectus femoris, so the longest quadricep muscle that crosses the hip. So it's one of the hip flexors. I avulsed the proximal attachment from the bone. So the muscle pulled so hard that it pulled off the bone with a piece of bone. Anyway, so I lied down. I couldn't even straighten my leg out because straightening my leg out was pulling so hard on my hip flexor that it was like so painful. But I laid down. John was like, just breathe. And he was like, I really wanted to pull out, but he said, just start warming up. Let's see how it goes. I actually PR'd my deadlift in the competition, and I couldn't believe it. I have shout out to 9 for 9. They no longer take meet photos anymore, but I have this moment. I like should frame this picture because I couldn't believe that I finished the meet. You see it in my face in the picture. I'm just like in utter shock that not only did I finish the meet, but I PR'd my deadlift in that competition without injuring myself any further. Like it didn't hurt at that point. So this is a funny thing is sometimes when you actually like tear something or it doesn't hurt anymore. So it didn't hurt at that point. But then I went on to do the pro bench in the afternoon and the load that I fractured my hip on, I actually completed in the pro bench in the afternoon. So I still did get that PR on the bench press that day. So I did, I was successful in that day, both mentally and physically. It was pretty cool. But it was not good after that. It was,
You had to go home and pick up the pieces.
I had to like somehow get that bone to heal. So we thought we didn't know at the time that it was a fracture. We thought it was a tear of the hip flexor or something, or just like very, very bad strain. So I tried we thought it was the muscle. We didn't realize it was the bone. So I started to do something called the STAR Rehab protocol, which is used for muscle belly tears. And you usually use the lift that's most irritated to do the protocol. So I put on one of the things that I bought and used like religiously when I had my first hip flexor irritation with my hips was Ray-Ban squat shorts. So they're like knee sleeves for your hips. And so John was like, just put those on, start squatting. And I couldn't even squat the bar. I tried, I wrapped my hip. I took like a knee wrap and I tried to like wrap it. Like, when you get like an adductor strain and you can like wrap it, and just nothing was working. And I couldn't do it. It was like, with one rep, my body was in like full sweats. Like it was so bad. So then I don't think that I squatted that week. And I said to John, like, this isn't feeling better. Like, if it was usually it starts to feel better. And I was like, this isn't feeling any better. So I went to the doctor, my favorite doctor, Brian Neary. And he told me I fractured my hip. He told me I had an avulsion fracture. I was like, wow, that's cool. Never saw that in powerlifting before. But now we knew what we were working with, and I think that's important. We don't get imaging unless the protocol that we're doing or the treatment option the treatment approach that we're taking isn't working. And I was not responding like the way that we expected me to respond, which is why we went for imaging. And, I had bench press world championships coming up. And I said that, I was like, yo, doc, like we got the world championships coming up here. He's like, well, let's give this a couple weeks. And, like you're a high level athlete, you're a physical therapist, like we'll just do PRP injections if you're like not moving along well enough. And I was like, all right. So, went home. I actually didn't end up doing the PRP injections because I did do the STAR rehab protocol, but with split squats. Because the squat, I couldn't squat at the time. The squat was too much hip flexion, and it wasn't the right stress on the muscle because of the way that the muscle crosses the joint. I needed to like lengthen the muscle. So the split squat with the leg back lengthens the muscle to kind of facilitate scar tissue and blood scar tissue healing in the right alignment and all that kind of stuff. So I did split squats, which was brutally painful, but I managed. And then I did that for a couple of weeks and then switched to squats, kept my shorts on the whole time, my Ray-Ban shorts on the whole time. Yeah, got my squat back, but I have not PR'd my squat since. But I did like, Larson bench, or I think I probably did like feet up bench for a time because I couldn't do leg drive. Like I could not put my legs down. It was too much hip extension. And so like the question is like, how does one fracture the hip benching? Right. So in retrospect, I was having this hip irritation before, the Arnold. And obviously like something happened to my hip. It's my better hip. So clearly like my left hip, I was compensating or something with my right hip. And when you leg drive, your quads are, you have an isometric contraction of your quads, your hamstrings, your glutes, like everything, right? And so I put so much power into that leg drive to get that bench up that one side of the muscle gave, I guess. And there must have just been some weakening at the hip at that point, from whatever was going on in my training, because I did feel something. But the 2017 nationals, I had a squat mishap. I was working with Mike T for years, and I hadn't PR'd my squat with him. PR'd everything else, but not my squat. And at some point, he had me squatting 4 days per week. We had to pull back on that. He was doing this like weird thing with programming where he had 2 microcycles in a week. So it was just like way too much, and my squat was not performing well with it. So I went into nationals, was it 2018, I think? I don't know which nationals it was, but I went in like dying for a squat PR and like so anxious about squat that I put the wrong belt on for squats. On my my second attempt squats, I failed, like totally out of the blue. Came back and got the same load on my third, and then realized after, it was like so weird. Like I had my handler, which was Chris Aiden, and he became my coach after that. And my coach, Mike, who like sees all my videos all the time, and Chris sees my videos all the time too. And like no one realized that I had the gray belt on it. And I didn't even realize that I had the gray belt on instead of the black belt.
Why Why was the gray belt even out of your bag at that point?
Well, I don't know. I
Did
took
you
the
warm
wrong
up with
one.
it?
No, I guess. I don't know what happened. Like I was so anxious about squats, I grabbed the wrong belt. Who even knows? No one knows. John didn't even know because he saw my video. You know, like Chris would always send my video of the squat to John, or he was watching the live stream. Like no one noticed. Like John, Chris, and Mike didn't notice I was wearing the wrong belt, and I didn't notice. Obviously, we noticed after. Anyway, so then coming into nationals was it 2018? Yeah, nationals. I don't know, my last nationals, which was after my hip fracture. I maybe my hip fracture was 2018. I can't remember. But anyway, my last nationals, I literally on my opener fell over like Leaning Tower of Pisa. It was the strangest thing. I've never failed a squat. Like, I mean, I failed squats, but I've never I've maybe failed like a few squats. It was so weird. I just toppled over. I walked off the platform and I said to Chris, don't ask. Just, I'm okay. I don't know what happened. And it's all mental because of all the things that it wasn't PRing my squat because of like overtraining it. I was anxious because of the last nationals where like I messed up with the belts, like the hip fracture, like everything. I was so anxious that I just fell over. Yeah. So, but then I didn't PR that meet because we didn't go up on my second attempt like we were supposed to. So my third attempt was my second attempt, but PR'd everything else that meet. But anyway, so that's kind of like my hip story. And like I'm still trained, and I had no hip pain when I was pregnant, which was something I was so worried about, but I had zero hip pain.
I think that's a really good example of how stuff happens. So whether it's because of an injury, a current injury, past injury, mindset, whatever it is, sometimes like even a high level competitor is going to topple over on their opening squat. Like
so weird
stuff happens. And
I have an article about it, so I'll put it in the show notes for this episode.
And sometimes, sometimes it's like, whether it's you took a step or you just missed the lift, and it's not always, oh, you just didn't make progress or you didn't get stronger. Sometimes it's what's happening in your head, but sometimes stuff happens, and not every meet is going to be perfect. Obviously we want it to be perfect. We're going to adapt things the day of. And I think that's the really important part. Like if something goes wrong or not, or it doesn't go according to the optimal plan.
And I mean, this was my first lift of the
first
lift.
Like she was just getting started.
I was like, oh, that could like ruin a whole meet for people. And I was like, you know what? Brush it off. That never happened.
You have to adapt. And, I think I'm relatively cold with people when they miss a lift because I'll just say, it's over. It's behind you. I don't care. Like we have the next one coming. Like whether it's a third bench and we're moving on to deadlift, don't let that first squat that you missed affect what happens for the next 8 attempts that you have on the platform still, because you have the potential to allow that to completely ruin the day for you. Yeah. Or you could still come out of it like, holding it together. But it's really about adapting in those scenarios, because obviously we always want to go 9 for 9 and we always want to hit PRs, but the longer you train, it's going to be harder to have that every meet. Like not every meet is going to be, sometimes it's just about putting together a good day.
Yeah.
Because there's all kinds of other things that happen, whether it's in training before you get to the meet, whether it's at the meet. I always say that, the most successful athletes are able to adapt to whatever is going on that day. And if you can't adapt to whatever is thrown your way, then we can run into problems. But it sounds like you were able to adapt to.
Well, I've had practice adapting because that like if there's anything that can ruin a meet, it's fracturing your hip.
Yeah.
And so, but I've oddly not had any issues with that hip. I do get some pinching sometimes. But I've gone back and forth between heels and no heels on my squats. So like a weightlifting shoe and flat shoes. And sometimes heels irritate my knees, so I'll go flat. And then, I have some ankle limitation on my right foot. which could be related to why I had the fracture. Who knows? But so then I want the flats make it a little bit more challenging and cause some hip pain because I lack a little bit of ankle mobility in the right foot. So then I'll go back to heels. So I go kind of back and forth. But one thing that we're going to talk about when we get to the foot and ankle month is the ankle mobility issue that I have, and how I have used only the barbell to change the tissue length in my ankle. And I do no stretching. So that's like another story for another day. But I don't think my fracture was related to that. I think the fracture was ignored symptoms in combination with load and time under tension that led to. But the lack of squat progress was, I really think, happened when my squat was being overtrained by my coach. And then I had some performance mishaps, like the belt, and the lack of PRing because of the overtraining that led to anxiety plus the fracture. Then also, like, those four things: overtraining, lack of PRs on my squat due to overtraining, the mishap in nationals with the belt, and then the hip fracture. Kind of led to this really this mental block in progressing my squat after that. It's funny because we've had the interview with this month coming up. We have an interview with Eric Helms, like I said, and then we have an interview with one of our own clients who's an orthopedic surgeon who had 2 hip surgeries for FAI. And I wonder, Eric talks about in his episode how his decision to have surgery was because he wasn't progressing his squat. And Matthew talks about, the change in his symptoms and how the surgeries have really relieved his symptoms. And I questioned after sitting down with those guys, whether or not I want to have surgery. But some things that you have to consider when it comes to surgery are what does your life, what goes on in your life? Do I have the ability to not be at 100% right now? And no, I don't. I have a 2.5-year-old, I don't have enough help to have surgery. Not that my husband is not helpful. He is totally helpful. John, you are very helpful. But the amount of help that we would need if I were to have surgery at this point would be much more. And I just don't have the time to dedicate to the rehab process after surgery, and I don't have the help to take care of my son in the capacity that he needs as a mom to have surgery at this time. So I'm just waiting to have a hip replacement later on in life versus to the labrum and FAI surgery at this point in time. So anyway, that's where we're at. If my squat doesn't progress for the rest of my life, I'm okay. To be honest,
you're still squatting, and you're squatting more than a lot of people. Mm-hmm. And even if you're not hitting a squat PR, you're training, you're still strong. Mm-hmm. You're going to be better off, 20, 30, 40 years from now than you would otherwise.
Yeah.
So, that's the setbacks.
That's the other thing is I had the FAI before I started barbell training. I had the symptoms of the labrum tear before I started barbell training. So, and we talk about this all the time, especially when we look at the research, these things are not a result of barbell training. They are there, and they might be, your attention might be brought to them because of barbell training in combination with the rest of your life. And just like you said, me being better off barbell training because it makes me stronger. It makes me able to handle what's going on maybe if I wasn't barbell training, I would have had surgery already because my hip wouldn't be strong, and able to handle and tolerate the loads that life places on it.
And you'd have probably a more challenging recovery from surgery as
exactly. Well. And so I continue to barbell train, even though I'm not making a ton of progress with my squat. There's other things, obviously, I have a 2.5-year-old, and I haven't lifted over 300 pounds since since he's been born. But so that's like another story for another day. But I'm strong. And when and if and when I have a hip replacement in the future, I will be stronger than most people going in for a hip replacement, and that will make the outcome and the recovery process of the surgery better. So you should not let your diagnoses or your symptoms stop you from training. You just have to train smarter.
And you don't have to selectively choose who you procreate with.
Right.
Based on their hips.
But I chose a very perfect specimen so that hopefully my child has a better chance of not having messed up things going on. My husband has hip issues also. So like he probably has a labrum tear in his hip. He just doesn't know about it. He's like, well, I don't want to get imaging because like I'm not going to have surgery, so why should I get imaging? And then he just stands up off the couch and he's like, ugh! And then he starts walking again. So in any event, well, we share my story this month because it's hip month, but really I just want to share it because we understand, like Alyssa, we should probably talk about at some point some of the things that you've gone through because you actually did a good job sitting here today with your little back tweak.
I'm uncomfortable. I've been trying to like limit it. I can't wait to stand up.
I know. No, you've done pretty good. But I forget what movie. I think it's from Tremors. There's this hairdresser in this movie Tremors, right? It's a Kevin Bacon movie if you haven't seen it, from like the 90s. But anyway, she's a hairdresser, but she has like terrible hair, right? And she says you always tell who's like the best hairdresser based on how messy their hair is, because they're always taking care of other people, but it's like, my point being is that you shouldn't choose a physical therapist or a coach because they're not injured or they're not dealing with things, or you shouldn't dismiss a coach or a physical therapist because they are injured, like we're humans, and we can really understand what you're going through because we've been through it, been through the insurance authorization process. I've been through the process of deciding whether or not I should have surgery or when or why, or I've had the mental and emotional recovery process from injuries and failures and all that kind of stuff, and that's what makes us human and relatable, so yeah.
Yeah, I agree. I don't think that looking for the injury-free person is always the way to go. And we're all human. And we kind of started this by saying like we can all get injured. Stuff happens. Sometimes everything is perfect. I tweaked my back. Quite frankly, everything appeared to be perfect. But so, and it happens, but having firsthand experience, not just being able to navigate that with training and continuing to train instead of just not training, but also the firsthand experience of the stress of dealing with that, the anxiety of dealing with that. If someone's training for a meet, whatever it is, like there's a lot more than just the physical aspect of it that goes on, and being able to understand that I think is really important. And like, if anybody thinks that we don't understand, we do. We know that it sucks, and it doesn't have to ruin you.
And that's not my only injury.
Yeah.
But yeah. Anyway, but most of my injuries are not a result of barbell training. They're just things that existed, before. Yeah, obviously that back tweak was, I had a couple back tweaks that were like happened in training, but like it wasn't because of the training. Like I told you, it was, I had the MRI with contrast, and then like my hip just wasn't ready after that, and that's when I tweaked my back. So in any event, if you guys have any questions about my story, or you've got your own injury, hip injury that you need some help with, definitely tune into the podcast this month and check out all of our hip episodes and our injury series part 1, 2, and 3, our sustainable training episode. We'll link all that in the show notes. You can join our free Facebook group, The Secret Society, if you need help with your technique, because technique is definitely part of the puzzle. Like, it should not be ignored. And we do free form checks in there on Wednesdays and Fridays. And you can book a free consultation with any of the clinical coaches here at PRS if you need help with some injury management. And you can get on our newsletter to get our podcast early, and we do some free content in our newsletter as well. So anyway, guys, thanks for listening. I've been waiting to share this. So I hope that it helps inspire, helps you feel less alone, and gives you a little bit more confidence to keep moving forward with your training despite what you may be diagnosed with or feeling in your body. All right, guys, bye for now.